Hello everybody, this is Kim with AHE Health and www.si-instability.com. This is February 17th. I'm just about almost 24 hours post-operative of my left elbow surgery done by Dr. Thomas Trumbull at Bellevue Bone and Joint here in Bellevue, suburb of Seattle. I have an incision about this long right here. It was my lateral collateral ligament of my elbow was partially torn, and there was also scar tissue built up in there, and so that was debrided, and the ligament was re-anchored, and they also used an Arthrex fiber tape called like the internal brace to re-anchor on top of it for additional securing of the joint. I was having radiocapitellar joint gapping on a stress fluoroscopy. And then some pain here on the lateral side, and I also have the TFCC tear, and so they did also a PRP, platelet-rich plasma injection, over the surgical site and into my wrist to help give that more healing in hopes to prevent a wrist surgery in the future. See how we do first with the stabilization of the elbow. And then they also gave, I'm black and blue on this elbow because going into the surgery, right at the very last minute found out I had a little tear of one of my tendons coming into my lateral epicondylitis over here on my right elbow. So it was injected with PRP while I was under anesthesia during this surgery. So at 24 hours, I've basically been able to make it on 10 milligram hydrocodone every 4 hours, 4 to 6 hours. The last 2 doses have been about, I've been able to stretch it to about 6. It's just like heavy, achy feeling through here. I can move my fingers. Some, they're not excessively puffed up and swollen, but they're swollen. Just achy, like a heavy, deep ache pain because of the anchors that suture or put the ligament back into place. However they do that with the Arthrex anchors. So 24 hours after surgery. It's normal pain to be expected. I don't think I have any excessive. I was able to go down to the restaurant and the hotel this morning, have breakfast, and come back up. But pretty much, I keep it elevated like here, or if I sleep at night, I'm sleeping with it up like this. And I've been able, I was able to get 4 hours straight sleep last night between doses of medication. So it is what it is, and I just like to give that update, and we see the doctor in 2 more days for like a 3-day post-op follow-up, and we'll go from there. It's splinted. There's a heavy splint that's going all along this side of my arm, up all up the back side, and it's just thick heavy padding on this side. So I mean I can move my arm without hurting the surgical site anyway. So I guess it's all good. Thank you for watching.